Hi, I'm Dr. Roadhouse. Welcome to the Ask Dr. B show. Today we have our guest, Katie Tallent. And Katie is a massage therapist, and she uses essential oils. We've actually had several patients over the years in common, and I really like Katie as a tool for our patients to improve. Katie doesn't just do like a fluff massage, there's nothing wrong with that. But what I like to use Katie for is when I have a patient and they have a chronic problem, and we address that problem, we get the pressure off the nerve, and sometimes those muscles in a chronic situation have shortened, and because of the spasm, they haven't been able to go through their regular range of motion, and so we have to get that to loosen up. Now, a lot of the patients, it just happens naturally as they go through the treatment and we get the pressure off the nerve and the condition returns, but there are some patients they don't. So I like to send them to Katie. And the thing I like about Katie is when I work with a lot of other massage therapists, I have to call them up and go, hey, look at this area and this area. All I got to do with you is just say, hey, look at the neck area, the shoulder, the scapula, subscapular, or whatever like that. And she goes and she finds the things, and you almost as good as a chiropractor, a good chiropractor. So that's what I really like about it. And then so anyway, why don't we kind of talk a little bit about some of the things that you can help patients with massage therapy, because I mean everyone knows the benefits of massage therapy and increasing the range of motion, increasing the blood flow and stuff like that. But there's a lot of different facets to massage. Why don't you just talk about some of the ones that you particularly, because everyone has a type of patient or conditions, that they like to work on. So what are some of the things that you really, you're passionate about?
I offer 3 basic massages. So if anybody ever calls me for a session, I always ask what the purpose is that they're coming in for. Is there an injury? Is there pain involved? Or is there stress and anxiety? And I like to figure out the best way to address your specific issues, because every body is different and every situation that we've all been in is different. So I like to customize the session. I do a basic massage where I start at the head, neck, and shoulders, but sometimes we'll just do an upper body if that's what we need to focus on, and sometimes just a lower body if we. So whenever you decide that you need a massage or who refers you, I like to work very specifically. So the three that I offer, first of all, the first one would be a Swedish massage, which is really great for stress and anxiety. So it's very gentle. I work a lot on the lymphatic flow and removing toxins that way, and also circulation. And it is deeply relaxing. And by the time you get off the table, you should have some emotional strength, some mental clarity, maybe a little bit of a massage hangover afterwards, but you'll have a lot more. Your body will be free of those toxins. We like for you to drink a lot of water because the toxins do get pushed into the lymphatic system, so you want to drink a lot of water to flush that out, because you could have soreness and that sort of thing. Even with a Swedish massage, you could have soreness just if we're trying to push toxins out of the muscles and out of the circulatory system. So that's the first one I offer, especially good for stress and anxiety.
Can you just go into, because a lot of people that are watching might not even know what the lymphatics are or what you're doing with that. So how does that, your massage technique,
Weather. It's Oklahoma.
Great. Well, that's never happened before. It's how you react, right?
Right.
So anyway, what we were talking about was with the lymphatic, because when you just say lymphatics to some people, they don't understand how important it is.
Right.
And that's basically how your body gets rid of all the things that the liver and the kidneys that are trying to get rid of that could be harmful to you, all these different substances. So when you talk about that, what exactly are you talking about? What do you mean, and how do you go about working with the lymphatics?
We have interstitial fluid, and that holds. So when I'm doing a massage and you have toxins, whether they're environmental toxins or food toxins, and even emotional toxins, we hold emotions in our muscles. And so as I'm kneading the muscles and pushing things through the muscles, it comes out into the lymphatic system, into the interstitial fluids. And we have two main areas, the inguinal area, which is like your groin area, and your axillary area too, where we have a lot of lymphatic nodes. And so all of my techniques when I'm doing more of a lymphatic massage, it all goes towards those, it goes towards the heart, and it goes towards those nodes to help flush that fluid through so that it can be filtered out. And so that's the reason why it's important to drink a lot of water, because you need to replace those fluids, because you will probably be needing to use the restroom after a massage, and that helps to just flush all of the toxins out. So a lot of my techniques when I'm working with the lymphatic system is very, very gentle, because you don't want to push too hard where those nodes are, because they have like little doors on them, right. And if you push too hard, yes, then they'll close them off. So that's the reason why Swedish massage is really good for lymphatic flow and all of that, because it is gentle and you can work with pushing the fluids through without closing them off.
Yeah, and as far as that goes, you can go to PubMed, which is medical journals and research they've done, and you can find all kinds of journals and research are talking about, especially for women, in the axilla area on the lymph. Mm-hmm. So basically, kind of reiterate what you were saying, mm-hmm. is that the toxins and from the everyday life and the stresses and everything, if they're not drained, then they can pool in this area. Mm-hmm. And there's several research papers have done that said that the lymphatics need to be drained, and it will help prevent breast cancer. So this would be really important, especially for any women that have a history of breast cancer. And of course there's genes and stuff, but I mean, that can make things worse. But if you have that gene, definitely you want to do this, and you should probably just go once a month just to make sure nothing builds up. But you can look up some research, and you're talking about, that there's valves on the lymph, and they let it up, and so you don't want to be pushing down towards the limbs. You want to bring it out to the heart. So so everything she's saying, I mean, there's scientific validity to it. Yes. So that's awesome. Okay, so what's the next one?
Well, and actually, just to tack onto that as well, if there have been issues with breast cancer and mastectomies, then you can then actually being very gentle and pushing. You don't want to end up with lymphedema. So if you use a wrong technique, you can actually cause someone to have lymphedema. So it's important to go to somebody that understands that and how to push the fluid towards the heart so that it doesn't get trapped in the fluid in the arms. So that's important.
That's a really good point.
So that's important. Okay, so the other thing that I do, I don't like to call it a deep tissue massage, because that kind of scares people a lot of times. Some people are just like, yes, give me deep tissue massage. But I like to call them muscle and joint therapy, because everybody's deep tissue is different. So what I would consider deep tissue on my body is going to be different than what he's going to consider deep tissue on his body, and I'm going to use different pressures. So I don't even like to call it deep tissue. I like to call it muscle and joint therapy, because I'm working with the muscles, I'm working with the joints in a very specific way, and using different techniques than I would be using, say, in a Swedish massage, which is more lymphatic and circulatory. So, for instance, one of the working very specifically, I like to find trigger points. The body has lots of different trigger points, and the way I like to describe it, this is probably not super medical, medical terms, but
like my son
simply,
says, right?
Yes.
Dumb it down.
How I like to describe them is we have fascia through our whole body. It holds all of our organs and everything together.
What is the fascia like? So other people
fascia,
understand.
if you were to look at an up close picture, it almost looks spider webby. And so basically it's connective tissue. So it's holding all of our organs and everything in place, so we don't just kind of blob all over. So it holds everything into place. But I like to refer to it like a full body sweater. And so say when you have on a sweater and you get a snag in your sweater and that sweater kind of bunches up, that's what a trigger point would be like. And so what I'm doing is applying pressure to that trigger point to help to release that snag in your full body sweater. So that's a lot of what I'm doing.
Yeah, and a lot of the trigger points are like minor spasms within the body because they're overused, and then they get endorphins and enkephalins and byproducts from your body trying to get rid of all of these things, and they can get stuck in, and it's also from an overuse type thing too. So there's different causes and different reasons as to why you get the trigger points, but that's really good method that you're using, and that helps a lot of patients because you can work on, like let's take for example like sciatica. You know, to have a successful resolution of sciatica, you have to know exactly what's causing sciatica, and there are so many different problems and reasons why. I mean, it can be in the lumbar spine, it could be some arthritis, it could be a disc bulge, spinal stenosis, it could be a facet syndrome, it could be a sacroiliac joint problem, it could be a piriformis syndrome, and it can be an iliolumbar ligament that is pinching the sciatic nerve. So you have to figure out all those things. So that's why, like, if patients come to you and they have sciatica, and you check them out and you find out that they have trigger points in the piriformis syndrome, you work those out, and that's why the sciatica gets better. But on those patients that don't, and you work a trigger point, then you go, oh, and that's when you send them our way.
Right.
So there's, you know, the trigger point is really important as far as taking care of the patients, because especially if they have a chronic situation, you're not going to find that a lot in someone that's only had it for a couple of weeks, but you find that where patients have it like long term, and the longer you have it, there are mapped out areas on your body that you know of that are trigger points. They were first identified by Janet Travell, who's a medical doctor, and since then they've expanded on that. But basically there's trigger points in certain areas, and the longer you have a chronic situation, the more trigger points you're going to have. And that's what really helps with a lot of our patients on the chronic, because we deal with a lot of really bad, tough cases, as you know, and sometimes we have to send them to you to help us with those, and that's how you're helping them.
Right.
Okay, so was there another thing that you did?
Yes,
okay.
and just to play again off of the trigger point therapy, it's kind of, the myelin sheaths, they should move in and out of each other really smoothly. And with trigger points, it's like it gets sticky. And so a lot of times I like to say we can solve a lot by just drinking enough water, because a lot of times with dehydrated muscles, those trigger points are gonna get really cranky. So water helps a lot with that. But with trigger point therapy, it is not very comfortable. It is a deep tissue technique, and I apply pressure and I hold. And there's a couple of different ways that you can do that. You can hold until it releases, but sometimes I find that actually might damage the tissue. So a lot of times I like to do more of a pumping technique, where I hold that trigger point for about 10 seconds, and I like to let it release, because then what happens is that pushes the blood and the lymph and everything out of that area, and then when I release, everything rushes back in. So you have fresh blood, oxygen rushing into the muscle, which it has been missing, because it gets cranky. So,
especially if it's a chronic situation, when you put pressure, you don't want to cut off the blood supply and cutting off the lymph and the venous flow. Right. So a lot of times that works a lot better. But anyway, we had a question, comment. They want to know, is there a difference between pressure when you do it and then trigger point? So you kind of just answered that, but I mean, just to make sure that, you know, if they've got a question, we want to make sure to clarify that.
Well, I would say that even pressure points have a lot to do with more of our energetic pathways even. Trigger points, there's definitely a map to them, and pressure points, there's a map to them. But pressure points, I think, deal a lot with more clearing some of those electrical and energetic pathways that we have in our body, which is, I was trying to remember, I think there was like 70,000 energetic pathways through our body. So pressure points really help to relieve those issues that are happening electrically and energetically as well. And so trigger points are dealing with those spots in our muscles where it gets sticky and cranky. So.
Yeah, very good points. So this has been really informative so far, so I'm really excited. But listen, if you know anybody that's having any chronic health problems, or they have some aches and pains, or they're interested in maybe massage or anything, you know, that anything to do with any of the pain syndromes, share this so we can spread the word and give Katie some likes and some hearts over here, because she's doing real good. I want to thank RJ Maxwell for liking it, Pure Mao, Chris Jensen, Elisa Burkhart, Brenda Morgan. Hi, Brenda. And anyway, so I guess after that, you know, there's trigger points in different parts of the body and stuff like that. Talk about like when a patient comes in and they've got some myofascial trigger points or any of the tendonitis, you know, because there's a lot of conditions that are from a lot of our hobbies and our work that we do that are repetitive in nature, and then that area just gets fatigued and stuff. So what can you say for, like, you know, plantar fasciitis or tennis elbow or golfer's elbow or anything, any of the tendinitises like that? I mean, what's your approach on those?
Well, anything that ends in an itis is going to refer to inflammation in that area. So anytime I hear something like that, I'm always trying to be cautious of getting as far into the body and as far into the muscle as I can without having the body have an adverse reaction where there's going to be a lot of inflammation and where you're going to be walking away really, really hurting too. So I try to find a nice balance, and again, everybody's body is a little bit different. But let's take plantar fasciitis, for example. A lot of people deal with that. It actually has to do with a weak tibialis anterior a lot of times. And so I like to work, in massage therapy, I approach the body holistically and not just in parts and pieces. And a lot of times I think in the Western world, we think of our body as, you know, if I'm having pain, if I'm having pain in this one area, then I need to work in that area. So I like to always tell people when they come in, just because you're having pain in one area doesn't mean it's not being caused in another area, because we do have to approach it as the body as a whole. So plantar fasciitis is a really great one because there's an imbalance in the leg muscles, and there's one that's probably overly tight and probably overly used. So I like to work both sides of that, and then I do a lot of stripping on the bottom of the foot, which again is...
They don't know what stripping is, so...
Stripping is, it requires a lot of pressure. It's definitely uncomfortable because you're pretty tender there anyway, but it's a pressure where, like with trigger point therapy, I'm pushing directly in to that and holding it, but with stripping, I'm actually moving along the length of the muscle, and with a lot of pressure, and so it's almost like scraping the muscle. And so I will strip out those muscles on the bottom of the foot to help them to release. And stripping is really also very good for any kind of scarring. I can do cross fiber friction, where I go, because our muscles run in certain directions, and so cross fiber friction is where I'm running across that muscle. And again, it's not very comfortable, and it is a deep tissue technique. But then the stripping is where you go along the muscle with a lot of pressure, and it's a lot like scraping.
And both those, you know, when you have an injury and you have tendonitis, your body's going to try and heal itself. And so what it does is it puts scar tissue in there, and it's a cheaper grade of tissue. It doesn't flex as good, doesn't extend as good, and it's not as strong. And so it's subject to re-injury. But if it's going across like that, you know, if it's in the early stages, then you want to try and break that scar tissue up so it doesn't, because basically what it does a stranglehold around the tendon, you know, or any of the areas, you know, where the problem is. And then just to piggyback on that, you know, I mean, what we do is we find that there's usually some bones of the feet that aren't moving, and it's usually the heel, because as you walk and plant your foot and strike, it has to go like this, and if this moves, everything is good. But if the heel doesn't move, and you go do that, then it stretches those, and that causes a tendonitis. And usually with patients, you know, they'll come in and we're working on this area here, and they go, well, it hurts over here. And a lot of times the area where the problem is, they're not really having these symptoms because it's the way that the body is adapted to that.
Right.
So those are real good. Okay, so anyway, we have a question, and it's, do you use certain oils or for certain or any certain massage techniques? In other words, I had a patient that gave me some massage oil, and so anyway, it was in a big jug like this. It didn't have a label on it. They just gave me some extra, you know, and I took it home, and I guess didn't realize it, and someone put it in our pantry.
Oh no.
And yeah, so then I had this friend of mine, Tim Tragle from Louisiana, who brought up all these shrimp and, you know, all this pork tasso and all that stuff. I probably said it wrong, But anyway, so he came up, and every time he came up, he would always cook, and we'd help and stuff like that, but he really wanted to do it and stuff like that. So anyway, he needed me to run the store, so I run the store, and anyway, when he comes back, he's got all these things going, and he did dirty rice, and when he got done with dirty rice, he goes, wow, this dirty rice really tastes kind of funny, and I'm thinking, and I tasted it, and obviously it had some menthol. I go, what did you use? I go, oh no, that was massage oil. So Tim, from being Louisiana, he was trying to season up so we could still use it, but it didn't work. We had to redo it. So is there a certain massage oil? I mean, because, people are going to go in there and they're going to get a massage. And after they get home, maybe they want to do it on their wife or their spouse or whatever, stuff like that. I mean, can they just use regular, cream, or what's the best thing for them to use? Because I know you want to use some oil to get so that there's not a lot of friction, so it makes it a lot more, pleasurable.
Right.
But is there any certain oil that works better, or any lotion?
Well, as far as massage oils go, there are some creams that I do like to use, but I really like grapeseed oil. Which is very easy, very accessible to get. It has a nice drag to it, but it also has a nice glide to it, and it works, for me, it works really well, so I'm not slipping off of people's muscles, but it gives me enough drag for that, but it also gives me enough, glide as well. So I would suggest grapeseed oil. Now, I use grapeseed oil in my practice, but I also incorporate a lot of essential oils, which are absolutely amazing. So that would, and I want to say hi to Evie and Sarah, but that also brings me to the third type of massage that I do, which is raindrop technique. So I offer a massage that is 90 minutes, and it incorporates a full body massage. And again, we talked before the session, and we address any kind of issues that you have going on in your body or emotions, that sort of thing. And then I customize the full body massage to your needs, so it can be, more of the muscle and joint therapy or more of a Swedish massage. But then I like to incorporate the raindrop technique, which involves 8 oils. I always forget, but they go in a specific order because they all do different jobs, and I can talk about some of their jobs.
Sure.
So basically, oils, the way the oils are made up chemically, they do 3 different jobs for us. Some oils, will detox, and they work at a cellular level. And so it goes very, very tiny. They can pass the blood-brain barrier and pass through the dura mater and all that in your spine, so your body can just completely absorb them at a cellular level. So the first few oils that we use, but I start out with Valor, which is a very grounding oil that we use, and we start out with that, and we balance the electrical system with some Valor. And then oregano is the first oil, and it's funny that you talked about cooking with oils, because a lot of these oils are going to sound like I'm cooking, because there are a lot of oils that you can eat. Actually, these oils you can put in your food, like if you're making pasta or something, so they are okay to eat. But I like to use oregano at the very beginning of the massage technique, because it goes in and it cleans out the cell receptor sites.
Okay.
And then we'll use thyme, basil, wintergreen, marjoram, cypress, and peppermint. And peppermint is a driver. So all the other oils that I put on your body go in, and the peppermint makes them do their jobs even better. But so for instance, oregano is the first oil we put in. It goes in and cleans out the cell receptor sites. And then the next few oils that I put on your body delete bad information. So say toxins, environmental toxins, food toxins, and emotional toxins. And it will delete that bad information. And then the last couple of oils go in, particularly cypress, will go in, and it reprograms the cell for health. So there's a lot of benefits to using these oils. It's a more gentle technique. So if you're worried about inflammation, the oils have anti-inflammatory properties. They are antiviral, they're antibacterial, they're antifungal, and they work not just at a skin level, but at a muscular level, and also into an organ level. So it's a very deep massage, and I use a feather stroking to disperse the oils, which is actually an energetic modality. So it actually creates energy in your body, but not a jittery energy like caffeine does. So, and you'll feel the effects of a raindrop for about a week. They are very detoxing, which is, again, it's really important to drink water after one of those. But I've worked on some clients really regularly, say for instance that have scoliosis. This is a really great technique for scoliosis because it does help to straighten the spine in conjunction with chiropractic care as well. So it helps to alleviate a lot of pain. Wintergreen has a component in it that acts a lot like aspirin. So it is very pain relieving and very anti-inflammatory, which is, we're always looking for, a lot of our diseases and disorders have to do with inflammation. So raindrop is really, really great for that.
Yeah, I would say that, like when it comes to acute care, stroke and heart attack, and medicine is really good at that, but with the chronic inflammation, they don't even have any information on that in medical school, and a lot of these are best treated with non-drug and non-surgical approach. Not that they don't need it, and we have patients, I do, that I'm here at St. Francis, and we have to refer that, but we want to use that as a last result. And so, like with oregano, you're talking about like any one that has like insulin resistance, where because of the diet that we have that's high in carbohydrates, and you get insulin resistance, so that would help with that. There's thyroid resistance, so obviously that, and basically those receptors get filled up, and it's hard for the glucose to get there or the thyroid hormones to get there. So anyway, those are all good for just general health, and I think there was, what'd you say that the other three do there? The wintergreen and
so the winter basil is really, really good for muscular relaxation. It's kind of like a muscle relaxer, and also marjoram is really, really great for relieving muscles, and it also calms the nervous system. And we're talking both voluntary and involuntary muscles.
Yeah.
So.
And this is really good because, if you're already, getting a massage, that's going to be, therapeutic and beneficial. And now you got this, so it just takes it one step further that you can do these things. It's at the same time when you're getting your massage, it's just only going to, increase your health, along with, plenty of sleep, drinking lots of water during the day, especially when you're doing that. But you should do it anyway. And then anything that you can do to help, to change your diet to help you feel better is always going to work. So anyway, thanks for being on the show.
Thank you.
And if you have any questions, you can email us at askdrbshow@gmail. You can leave some comments. We will put Katie's contact information after when we post this video later on. So if you want to make an appointment with Katie, we'll give you the information. So anyway, we look forward to seeing you next Tuesday at 12 o'clock at the Ask Dr. B Show.
Thank
Thanks for
you.
coming.